Okay, so this is chapter 1 of ATI Nutrition, Sources of Nutrition. Nutrients absorbed in the diet determine to a large degree the health of the body. Deficiencies or excesses can contribute to a poor state of health. Essential nutrients are those that the body cannot manufacture, and the absence of essential nutrients can cause deficiency disease. Components of nutritive sources are carbohydrates and fiber, protein, lipids or fats, vitamins, minerals, and electrolytes, and water. Carbohydrates, fats, and proteins are all energy-yielding nutrients. A healthy eating pattern includes foods that provide all essential nutrients and allows a broad assortment of food sources. Dietary reference intakes, or DRIs, are developed by the Institute of Medicine's Standing Committee on the Scientific Evaluation of Dietary Reference Intakes. DRIs are useful in understanding the food intake patterns of large groups, planning nutrition program standards like Supplemental Nutrition Assistance Program or SNAP, and helping individuals. DRIs are comprised of following reference values: recommended dietary allowances, or RDAs, the amount of a particular nutrient that most healthy people with a similar life stage and sex will need to decrease the risk of chronic disease. Estimated average requirement, or EAR, the amount of nutrient required to meet basic requirements for half of the people in the particular population. This reference is often used by researchers and policymakers and is used to help determine RDAs. Adequate intake, or AI, the amount of a nutrient that most people in a group or population consume. This is helpful when there is not enough data to establish an RDA for a nutrient. Tolerable upper intake level, or UL, the upper limit on the amount of a particular nutrient or the maximum an individual should consume. ULs are used when a nutrient is known to have adverse effects. Acceptable macronutrient distribution ranges, or AMDRs, the recommended percentages of intake for energy-yielding nutrients, which is carbohydrates, fat, and protein. Clients can use DRIs as a guide for nutrition intake, but should also consider individual factors that increase nutrient needs, like disease and injury. Carbohydrates and fiber. All carbohydrates are organic compounds composed of carbon, hydrogen, and oxygen, CHO. The main function of carbohydrates is to provide energy for the body. The average minimum amount, DRI, of carbohydrates needed to fuel the brain is 130 grams a day for adults and children. Median carbohydrate intake is 305 grams a day for males aged 20 years and older, and 228 grams a day for adults, children, and females in the same age range. The AMDR for carbohydrates is 45% to 65% of calories. Carbohydrates provide energy for cellular work and help to regulate protein and fat metabolism. Adequate amounts of protein in the diet creates a protein-sparing effect, which results in protein being spared from energy to use to perform its other essential functions. Brain and nervous system tissue require carbohydrates for maximum effective functioning. All right, so type of carbohydrates. These carbohydrates are classified according to the number of saccharide units making up their structure. So monosaccharides. These are simple carbohydrates like glucose, fructose, and galactose. Disaccharides are simple carbohydrates like sucrose, lactose, and maltose. And polysaccharides, which are complex carbohydrates such as starch, fiber, and glycogen. Considerations. The liver converts fructose and galactose into glucose, which is then released into the bloodstream. This elevates blood glucose levels, which causes the release of insulin from the pancreas. With insulin production, glucose is moved out of the bloodstream into cells in order to meet energy needs. The body digests 95% of starch within 1 to 4 hours after ingestion. Digestion occurs mainly in the small intestine using pancreatic amylase to reduce complex carbohydrates into disaccharides. Glycogen is then stored carbohydrate energy source found in the liver and muscles. It is a vital source of backup energy, but is only available in limited supply. To maintain glucose levels between meals, glucose is released through the breakdown of liver glycogen. Digestible carbohydrates provide 4 calories per gram of energy and make blood glucose levels more stable. Fiber. Fiber is categorized as a carbohydrate. Dietary fiber is a substance in plant foods that is indigestible. These are pectin, gum, cellulose, and oligosaccharides. Fiber is important for proper bowel elimination. It adds bulk to the feces and stimulates peristalsis to ease elimination. Fiber helps to lower cholesterol and lessen the incidence of intestinal cancers. It has also been shown to help keep the blood glucose level stable by slowing the rate of glucose absorption. Total fiber AI is 25 grams a day for females and 38 grams a day for males. The fermentation and metabolization of fiber in the colon provide 1.5 to 2.5 calories per gram of energy, depending on the type. Proteins. Proteins are provided by plant and animal sources. They are formed by linking amino acids in various combinations for specific use by the body. Types of proteins. There are 2 types of proteins. Each is obtained from the diet in various ways. Complete proteins from animal sources and soy contain sufficient amounts of all 9 essential amino acids, and incomplete proteins, generally from plants sources, can contain an insufficient number or quantity of amino acids, which limits the ability for protein synthesis. Complementary proteins are incomplete proteins that, when combined, provide a complete protein. It is not necessary to consume complementary proteins at the same time to form a complete protein. Instead, consuming a variety of complementary proteins over the course of a day is sufficient. Examples of incomplete protein pairs that provide complete protein include black beans with rice and hummus with crackers. Considerations. Proteins have many metabolic functions: tissue, building and maintenance, balance of nitrogen and water, backup energy, support of metabolic processes, nitrogen balance and transportation of nutrients over vital substances, support of the immune system, facilitating acid-base, fluid, and electrolyte balance, formation of neurotransmitters and enzymes, antibodies, peptide hormones, breast milk, mucus, histamine, and sperm. The 3 main factors influence the body's requirement for protein: tissue growth needs, quality of the dietary protein, and added needs due to illness. The RDA of protein is 0.8 grams per kilogram for healthy adults. Protein's acceptable macronutrient distribution range, AMDR, for adults is 10% to 35% of total calories. Underconsumption can lead to protein energy malnutrition, which is PEM. Kwashiorkor and marasmus are 2 disorders caused by extreme PEM. These serious disorders are caused by lack of protein ingestion. Protein provides 4 calories per gram of energy. Lipids. The chemical group of fats is called lipids. They are available from many sources: dark meat, poultry skin, dairy foods, added oils such as margarine, butter, shortening, oils, and lard. Fat is an essential nutrient for the body. It serves as a concentrated form of stored energy for the body and supplies important tissue needs: hormone production, structural material for cell walls, protective padding for cell walls, protective padding for vital organs, structural material for cell walls, insulation to maintain body temperature, covering for nerve fibers, and aid in the absorption of fat-soluble vitamins. Types of fats. Fats are divided into 3 categories: triglycerides, phospholipids, and sterols. Triglycerides are further comprised of fatty acids, which include saturated fatty acids and unsaturated fatty acids. Triglycerides total 95% of fat in food. They combine with glycerol to supply energy to the body, allow fat-soluble vitamin transport, and form adipose tissue that protects internal organs. Saturated fatty acids are solid at room temperature and are found primarily in animal sources. Unsaturated fatty acids, including monounsaturated and polyunsaturated fatty acids, are usually from plant sources and help reduce health risks. Sources of monounsaturated fatty acids include olives, canola oil, avocado, peanuts, and other nuts. Sources of polyunsaturated fatty acids include corn, wheat germ, soybean, safflower, sunflower, and fish. Essential fatty acids made from broken down fats must be supplied by the diet. Essential fatty acids, including omega-3 and omega-6, are used to support blood clotting, blood pressure, inflammatory responses, and many other metabolic processes. Phospholipids. Phospholipids, for example, lecithin, are important to cell membrane structure, as well as the transport of fat-soluble substances across the cell membrane. Sterols, for example, cholesterol, are found in the tissue of animals and are not an essential nutrient because the liver is able to produce enough to meet needs. If cholesterol is consumed in excess, it can build up in the tissues, causing congestion and increasing the risk for cardiovascular disease. Considerations. The AMDR for fats is approximately 20 to 35% of total calories. 10% or less of total calories should come from saturated fat sources. A low intake of dietary cholesterol is associated with reduced risks of cardiovascular disease, or CVD, and obesity. A diet high in fat is linked to CVD, hypertension, and diabetes mellitus. The exception is for children under 2 years of age who need a higher amount of fat to form brain tissue. Conversely, a diet with less than 10% of fat cannot supply adequate amounts of essential fatty acids and results in cachectic wasting state. The majority of lipid metabolism occurs after fat reaches the small intestine, where the gallbladder secretes concentrated bile, which acts as an emulsifier and enables the breakdown of fat down into smaller particles for digestion. At the same time, the pancreas secretes pancreatic lipase, which breaks down fat. Intestinal cells absorb the majority of the end products of digestion, with some being excreted into feces. Very low density lipoproteins, or VLDL, carry triglycerides to the cells. Low density lipoproteins, or LDLs, carry cholesterol to the tissue cells. High-density lipoproteins, or HDL, remove excess cholesterol from the cells and transport it to the liver for disposal. Lipids provide 9 calories per gram of energy and are the densest form of stored energy. Vitamins are organic substances required for many enzymatic reactions. The main function of vitamins is to be a catalyst for metabolic functions and chemical reactions. There are 13 essential vitamins, each having a specialized function. There are 2 classes of vitamins: water-soluble, vitamin C and B complex, and fat-soluble, vitamins A, D, E, and K. Vitamins yield no usable energy for the body, but they are needed for energy to be metabolized. Vitamin C, or absorbic acid, aids in tissue building and metabolic reactions. This is healing, collagen formation, iron absorption, immune system function. Vitamin C is found in citrus fruits, oranges and lemons, tomatoes, peppers, green leafy vegetables, and strawberries. Stress and illness, as well as cigarette smoking, increase the need for vitamin C. Cigarette smokers are advised to increase vitamin C intake by 35 milligrams per day due to increased oxidative stress and metabolic turnover. Severe deficiency causes scurvy, a hemorrhagic disease with diffuse tissue bleeding, painful limbs and joints, weak bones, and swollen gums and loose teeth. While scurvy can be fatal, it can also be cured with moderate doses of vitamin C for several days. B-complex vitamins have many functions in cell metabolism. Each one has a varied duty. Many partner with other vitamin B vitamins for metabolic reactions. Most affect energy, metabolism, and neurologic function. Sources for B vitamins almost always include green leafy vegetables and unprocessed or enriched grains. Thiamine, which is B1, functions as a coenzyme in energy metabolism, promotes appetite, and assists with muscle actions through its role in nerve functioning. Deficiency results in beriberi, which is ataxia, confusion, anorexia, and tachycardia, headache, weight loss, and fatigue. Food sources are widespread in almost all plant and animal tissues, especially meats, grains, and legumes. Riboflavin, which is B2, works as a coenzyme to release energy from cells. Deficiency results in chelosis. This is the manifestations include scales and cracks on the lips and in the corners of the mouth. Smooth, swollen red tongue, also called glossitis, and dermatitis of the ears, nose, and mouth. Dietary sources include milk, meats, and dark leafy vegetables. Niacin, which is B3, aids in the metabolism of fats, glucose, and alcohol, and synthesis of steroid hormones, cholesterol, and fatty acids. Deficiency causes pellagra. Manifestations include sun-sensitive skin lesions and gastrointestinal issues with impaired food digestion and excretion, as well as nutrient absorption and neurologic findings, anxiety, insomnia, confusion, and paranoia. Sources include meats, legumes, milk, whole grain, and enriched bread and cereals. Pyridoxine and vitamin B6 is needed for cellular function and synthesis of hemoglobin, neurotransmitters, and niacin. Deficiency causes macrocytic anemia and CNS disturbances. High intake of supplements can cause sensory neuropathy. Widespread food sources include meats, grains, and legumes. Pantothenic acid is involved in the metabolism of carbohydrates, fats, and proteins as part of coenzyme. A deficiency is extremely rare but results in generalized body system failure. Rich sources include meats, whole grain cereals, dried peas, and beans. Biotin serves as a coenzyme used in fatty acid synthesis, amino acid metabolism, and the formation of glucose. Deficiency is rare but results in neurologic findings, depression and fatigue, hair loss, and scaly red rash. Widespread food sources include eggs, milk, and dark green vegetables. Folate is required for hemoglobin and amino acid synthesis, new cell synthesis, and prevention of neural tube defects in utero. Folic acid is the synthetic form. Deficiency causes megaloblastic anemia, CNS disturbances, and fetal neural tube defects, spinal bifida, and encephaly. It is important that all clients of childbearing age get an adequate amount of folate due to neural tube formation occurring early in gestation, often before a client knows they are pregnant. Folate occurs naturally in the variety of foods including liver, dark green leafy vegetables, orange juice, and legumes. Cobalamin, which is B12, is necessary for folate activation and red blood cell maturation. Deficiency causes pernicious anemia and is seen mostly in clients who follow a strict vegan diet. B12 is found solely in foods of animal origin, and those who have an absence of intrinsic factor needed for absorption of B12. Sources include meat, shellfish, eggs, and dairy products. Fat-soluble vitamins. All fat-soluble vitamins have the possibility for toxicity due to their ability to be stored in the body for long periods of time. Absorption of fat-soluble vitamins is dependent on the body's ability to absorb dietary fat. Fat digestion can be interrupted by any number of conditions, particularly those that affect the secretion of fat-converting enzymes and conditions of the small intestine. Clients who have cystic fibrosis, celiac disease, Crohn's disease, or intestinal bypasses are at risk for deficiencies. Clients who have liver disease should be careful not to take more than daily recommendations of fat-soluble vitamins, as excess is stored in the liver and adipose tissue. Vitamin A, or retinol beta-carotene, contributes to vision, health, tissue strength and growth, and embryonic development. Retinoids are found in animal foods and are active form of vitamin A. Carotenoids are found in plants that are a precursor form of vitamin A, which the body converts to a usable form as needed. Care should be taken when administered to clients who are pregnant, as some forms have teratogenic effects on the fetus. Deficiency results in vision changes, xerophthalmia, dryness and hardening of the cornea, and GI disturbances and hyperkeratosis. Food sources include fatty fish, egg yolks, butter, cream, and dark yellow-orange fruits and vegetables, carrots, yams, apricots, squash, and cantaloupe. Toxicity can result from retinoids and is more common in clients who are taking vitamin A supplements. Vitamin D assists in the absorption of calcium and phosphorus and aids in bone mineralization. Sunlight enables the body to synthesize vitamin D in the skin. Deficiency results in bone demineralization, and extreme deficiency can cause rickets and osteomalacia. Excess consumption can cause hypercalcemia. Food sources include fatty fish, eggs, and fortified products, ready-to-eat cereals, milks, and orange juice. Vitamin E is an antioxidant that helps to preserve lung and red blood cell membranes. Deficiencies rare but results in anemia and can cause edema and skin lesions in infants. Food sources include vegetable oils and certain nuts. Vitamin K assists in blood clotting and bone maintenance. Deficiency results in increased bleeding time, used as an antidote for excess anticoagulants, which is warfarin. Vitamin K is found in carrots, eggs, and dark green vegetables like spinach, broccoli, and asparagus. Minerals are inorganic elements available in an abundance of food sources and used at every cellular level for metabolic exchanges. Minerals are divided into major and trace. Electrolytes are electrically charged minerals that cause physiological reactions that maintain homeostasis. Major electrolytes include sodium, potassium, and chloride. Major minerals occur in larger amounts, more than 5 grams, in the body, and 100 milligrams or more is required through dietary sources each day. The 7 major minerals are calcium, phosphorus, sodium, potassium, magnesium, chloride, and sulfur. Major actions, sodium, Na. Major actions: maintains fluid volume, allows muscle contractions, contributes to nerve impulses. Major sources is table salt, added salts, and processed foods. Findings of deficiency is muscle cramping, memory loss, and anorexia, and findings of excess is fluid retention, hypertension, and disorientation. Nursing actions is monitor level of consciousness, edema, and blood pressure. For potassium, the major actions are maintain fluid volume inside cells and muscle action. Major sources are oranges, dried fruits, tomatoes, avocados, dried peas, meats, broccoli, bananas, dairy products, meat, whole grain, and potatoes. Findings of deficiency: this is dysrhythmias, muscle cramps, and confusion. Findings of excess is dysrhythmia, muscle weakness, irritability, confusion, numbness, and extremities. Nursing actions is monitor cardiac status and ECG, give oral preparations such as tabs and elixirs with meals to minimize GI irritation. Chloride. Major actions assist with intracellular and extracellular fluid balance and aids acid-base balance and digestion. Major sources are table salt, added salts, and processed foods. Findings of deficiency are rare, muscle cramps, and anorexia. Findings of excess is vomiting. Nursing action is monitor sodium levels. Calcium. Major actions are bone and teeth formation, blood pressure, blood clotting, nerve transmission. Major sources are broccoli, dairy, kale, fortified grains. Findings of deficiency is tetany, positive Chavostex and Trousseau signs. ECG changes, and osteoporosis in adults, poor growth in children. Findings of excess is constipation, renal stones, lethargy, depressed deep tendon reflexes. Nursing actions is monitor ECG and respiratory status, give by mouth tabs with vitamin D. Magnesium. Major actions is bone formation, catalyst for many enzyme reactions, nerve muscle function, smooth muscle relaxation. The major sources are green leafy vegetables, nuts, whole grains, tuna, halibut, and chocolate. Findings of deficiency is weakness, dysrhythmias, convulsions, increased blood pressure, and anorexia. Findings of excess is diarrhea, nausea, muscle weakness, hypotension, bradycardia, and lethargy. Nursing actions is follow seizure precautions and monitor level of consciousness and vital signs. Phosphorus. Major actions are energy transfer at RNA and DNA, acid-base balance, bone and teeth formation. Major sources: dairy, peas, meats, eggs, and legumes. Findings of deficiency is unknown. Findings of excess is decreased blood calcium levels. Nursing actions is evaluate the use of antacids, note type, and use of alcohol. Alcohol impairs absorption. Sulfur. Major actions: a component of vitamin structure, byproduct of protein metabolism. Major sources is proteins. Findings of deficiency is only seen in severe protein malnourishments. Findings of excess is toxicities does not result in any health issues. Nursing actions: sulfur levels are not usually monitored. Trace minerals. Trace minerals, also called micronutrients, are required by the body in amounts of less than 5 grams, and 20 milligrams or less is required through dietary sources each day. The 9 trace elements are iron, iodine, zinc, copper, manganese, chromium, selenium, molybdenum, and fluoride. Iodine is used for synthesis of thyroxine, and the thyroid hormone that helps regulate metabolism. Iodine is taken up by the thyroid. When iodine is lacking, the thyroid gland enlarges, creating a goiter. Too much iodine can result in thyrotoxicosis. Grown food sources vary widely and are dependent on iodine content of the soil in which they are grown. Seafood provides a good amount of iodine. Table salt in the U.S. is fortified with iodine, so deficiencies are not as prevalent. The RDA is 150 micrograms for adults. Iron is responsible for oxygen distribution to hemoglobin and myoglobin. The body recycles unused iron from dying red blood cells and stores it for later use. Iron in food consists of 2 forms: heme, iron found in meat, fish, and poultry, and non-heme, iron found in grains, legumes, and vegetables. Iron supplements can cause constipation, nausea, vomiting, diarrhea, and teeth discoloration, liquid form. They can be taken with fluid to avert gastrointestinal manifestations, and nurses should encourage fresh fruits, vegetables, and a high-fiber diet. Supplements that are unneeded can become toxic. Vitamin C increases the absorption of iron. Clients during the menstruating years, older infants and toddlers, and pregnant clients are at risk for iron deficiency anemia. Toxicity can occur when there is too much iron stored in the body. Fluoride forms a bond with calcium and thus accumulates in calcified body tissue, bones, and teeth. Water with added fluoride protects against dental cavities. Deficiency can result in dental caries and increase the risk for osteoporosis. Toxicity can result in fluorosis, itching, and chest pain. Water is the most basic of nutrients. The body can maintain itself for several weeks on its food stores of energy, but it cannot survive without water hydration for more than a few days. Water makes up the largest portion of our total body weight and is crucial for all fluid and cellular functions. Fluid balance is essential for optimum health and bodily function. The balance of fluid is a dynamic process regulated by the release of hormones. Water leaves the body via the kidneys, skin, lungs, and feces. The greatest elimination is through the kidneys. Other loss factors include bleeding, vomiting, and rapid respirations. To maintain a balance between intake and output, intake should approximate output. Healthy adults lose approximately 1,000 milliliters of water daily through insensible losses. This is respiration, skin, and fecal. And to get rid of metabolic waste, need to excrete at least 500 milliliters of urine daily. Therefore, the minimum daily amount of water intake needed is 1,500 milliliters. Most water intake is from drinking fluids. Water is also present in solid sources: lettuce, gelatin, soup, and melons. Under normal conditions, the AI for adult water intake for females is 2.7 liters a day, of which 2.2 liters should be from fluids, and for males is 3.7 liters a day, of which 3 liters should be from fluids. Additional hydration can be required for athletes, persons with fever, illness, vomiting, diarrhea, and those in hot climate conditions. Fluid replacement can occur orally, enterally, or IV. Young children and older adults dehydrate more rapidly. Assessment for proper hydration should include skin turgor, mental status, orthostatic blood pressures, urine output and concentration, and moistness of mucous membranes. Thirst is a late indicator of the need for hydration, especially in older adults. Some individuals can have an aversion to drinking water and should be encouraged to explore other options: fresh fruits, fruit juices, flavored gelatin, frozen treats, and soups. Caffeinated drinks have a mild diuretic effect. However, tolerance develops in clients who regularly consume caffeinated beverages, which results in little to no effect on fluid volume. Phytonutrients, also called phytochemicals. Phytonutrients occur naturally in plants. They have positive health effects, detoxifying the body, stimulating the immune system, promoting hormone balance, and serving as antioxidants. They are found in fruits, vegetables, green tea, legumes, whole grains, and broccoli. No recommendations for intake of phytonutrients exist at this time. Vitamin D, fatty fish, eggs, and fortified products, ready-to-eat cereals, milk, orange juice. Calcium, dairy, broccoli, kale, fortified grains. Sodium, table salt, added salt, processed foods. Potassium, oranges, dried fruits, tomatoes, avocados, dried peas, meats, broccolis, bananas, dairy products, meats, whole grains, and potato. Vitamin A is fatty fish, egg yolks, butter, cream, and dark yellow-orange fruits and vegetables. Carrots, yams, apricots, squash, and cantaloupe. Vitamin E is vegetable oils and certain nuts. Okay, so a nurse is discussing health problems associated with nutrient deficiencies with a large group of clients. Which of the following conditions is associated with the deficiency of vitamin C? Select all that apply. And that's going to be B and E, which is scurvy and bleeding gums. A nurse is conducting a nutritional class on minerals and electrolytes. The nurse should include which of the following foods as a major source of magnesium? Tuna. A nurse is reviewing information about dietary intake of iron with a client who has anemia. Which of the following is a non-heme source of iron? Dried beans. A nurse is reviewing dietary recommendations with a group of clients at a health fair. Which of the following information should the nurse include? Make protein 10 to 35% of total calories each day.